Ah, Good morning, second year. So, i-discuss ko ngayon yung flagellates. So, yung flagellates natin sa book ng Zibig is chapter 4. So, start. So, brief overview lang. So, ating flagellates belongs to the phylum Protozoa and a member of subphylum Mastigophora and class Sumastigophora. So, it can be categorized in two groups, the intestinal and the atrial. Okay. So, Giardia intestinalis. So, ang common name niya is traveler's diarrhea. So, it is also known as Circomonas intestinal. So, the Giardia microorganism was originally discovered by Anton van Leeuwenhoek. He described the Giardia trophocyte from a sample of his own stool in 1681. So, in honor for the studies made by Dr. Lambel and Dr. Jard, which is a Czechoslovakian scientist, si Stiles, nagawa siya ng bagong name, which is we called na Giardia lamblia in 1915. However, many consider the name Giardia duodenalis coined by Davin in 1875. So the first recorded water outbreak occurred in St. Petersburg, Russia, and was also recognized during World War I as being responsible for diarrheal epidemics among fighting soldiers. So, ang dami kasing naging pangalan ni Giardia. Pero ang kino-consider na po na name ngayon is Giardia intestinalis. Okay, so trophocyte morphology. So, size range na is 8 to 20 UM long to 5 to 16 UM wide. So, it is pear-shaped. Yan, pear-shaped or teardrop. Falling leaf ang motility. Bilaterally symmetrical. So, it has two ovoid-shaped nucleus, each with large karyosomes, no peripheral chromatin. It has 4 pairs of flagella, one pair at the anterior end, 1 pair at the posterior end, 2 pairs central. Kita po ba? Yan. And then, other structures, meron siyang dalawang median bodies, dalawang axonemes, and isang sucking disc. Yan. So, ito yung sasabi nating motility niya, falling leaf motility. Then, it looks, yung itsura niya, characteristically, mukha siyang old man's face. Mukha daw matanda. So, the median body function is not clear, but the scientists believe it is associated with energy, metabolism, and support. So, the sucking disc covers 50 to 70% of the ventral surface and serves as the nourishment point of entry by attaching to the intestinal villi of an infected human. And so for our cyst naman, morphology, 8 to 17 to 6 to 10 wide. Shape niya is ovoid. Ovoid siya. So it has 2 immature cysts, then 4 mature cysts. Meron din siyang central karyosome and wala siyang peripheral chromatin. So retracted from cell wall. So other structures niya, sa median bodies, it has 2 immature cysts or 4 mature cysts, then interior flagellar structure. Tapos ito yung mga flagella, oh. Yan. So laboratory diagnosis, so specimen of choice is stool, so recovery of trophozoite and cyst. So multiple sample is recommended. Bakit po? Kasi the organism may be passed and recovered on 1-day sample and the following day may reveal no parasite at all. Kasi nagsishedding yung patient na infected with Giardia intestinalis or Giardia lamblia. So ano bang, para natin siya, mabantayan din yung pasyente. So kailangan talaga din is multiple sample para ma-determine talaga natin kung wala na ba talaga din siyang Giardia kapag once na nag-start na siya ng kanyang treatment. So other samples, pwede rin gumamit ng duodenal contents obtained from aspiration or upper small intestine biopsy. So other tests, pwede rin gumamit ng entero test or string test. Pwede rin gumamit ng enzyme immunoassay, pwede rin ELISA, direct fluorescence, then pwede rin ng Western blot. Then ang newest form for testing for Georgia is the use of PCR. It is sensitive enough for environment monitoring. So, ito ang ating life cycle for our Georgia intestinalis. So, the cysts are resistant forms and are responsible for transmission of Georgia. So, both cysts and trophocytes can be found in the feces. So, first stage natin is the cysts are hardy and can survive several months in cold water. Infection occurs by the ingestion of cysts in contaminated water, food, or by fecal-oral route, or by means of hand or fomites. So, once na nag-reach na sila ng small intestine, nagkakaroon ng excistation, and then the cyst will release trophocytes. So, ilang trophocytes daw po? 2 trophocytes po yung nire-release ng cyst kapag siya ay nag-undergo ng excistation. So, the trophozoites multiply by longitudinal binary fission every 8 hours, remaining in the lumen for the proximal small bowel where they can be free or attached to the mucosa by a ventral sucking disc. Then, ang mangyari naman, tapos na tayo sa excistation, so magkakaroon naman tayo ng encystation. So, during encystation, the parasite, bakit kulang? Transmit toward the colon. The cyst stage is found most in non-diarrheal feces. So, because the cysts are infectious when passed in the stool, person-to-person transmission is possible. While animals that are infected with Georgia, usually they become reservoir hosts, pero still unclear pa rin. So, una, may infect muna yung patient with cyst, ingested. Then, pag nakarating siya ng small intestine, magkakaroon ng excistation. Then, after excistation, mag-release siya ng 2 trophozoites. Then, si 2 trophozoites, yan, mag-multiply siya by longitudinal binary fission every 8 hours. Then, magkakaroon ng encystation ulit. Then, the cycle will continue. So, epidemiology found worldwide, usually found in lakes, streams, and other water sources. So, one of the most common intestinal parasites among children. Bakit? Kasi maglalaro sa labas o kaya sa tubig tapos subo o kaya kakamot sa puwet tapos susubo ang kamay. So, people at risk, daycare centers, children, poor sanitation areas, travel and eat, drink contaminated food in endemic area, and unprotected sex. So, bakit unprotected sex? Then, homosexual. So, kasi uso sa kanila kapag homosexual is anal sex. Alam naman natin na sa anus, dun po lumalabas yung ating feces. So, ano nangyayari? Pag nag-oral anal sex, so, sinubo sa bibig. Yan. So, may ingest mo yung Georgia intestinalis. So, reservoir host is the beavers, the muskrats, and water voles. Pwede din po ang sheep, cattle, and dogs. So, cysts are resistant to chlorination procedure. So, it may be transmitted by eating contaminated fruit or vegetables, oral and anal sex practice, and fecal oral route. So, clinical symptoms. So, asymptomatic carrier state. So, asymptomatic yung patient. Then, ang second natin is Giardiasis or traveler's diarrhea. So, yung ating Giardia intestinalis, meron siyang incubation period of 10 to 36 days. it is self-limiting condition that lasts for 10 to 14 days. So, pag sinabing self-limiting, after that, mawawala din yung sakit. So, chronic cases may cause relapses. So, usually, ang ating symptoms for Giardia is watery, foul-smelling, mild diarrhea, abdominal cramps, anorexia, flatulence, so tenderness of the epigastric region, steatorrhea, and malabsorption syndrome. So, yung steatorrhea, itong nasa picture na natin na nasa right side. So, pag sinabi natin steatorrhea, meron pong fats sa stool ng patient. So, di ba kapag may fat or kapag ang patient na merong steatorrhea, malalaman mo na may fat kapag yung iyong pupo ay lumutang. Tapos parang pag tinignan mo siya sa toilet bowl, parang may oil. Makikita mo yung oil sa surface ng water. Yan. So, severe cases, light-colored stools with high fat content produced by the irritated mucosal lining. So, fat-soluble vitamin, possible din na magkaroon ng fat-soluble vitamin deficiency. So, ano ba yung mga fat-soluble? Katulad ng vitamin A. Yan. So, pwede rin magkaroon ng folic acid deficiency, hypoproteinemia with hypogammaglobulinemia, and structural changes of the intestinal villi may be observed. So, according to the CDC, meron po tayong tatlong treatment, the metronidazole, tinidazole, and nitazoxanide. Pero, the FDA doesn't approve metronidazole for treating Giardia intestinalis because it is proven increased incidence of carcinogenicity in rats and mice, while the tinidazole is approved by FDA but also potentially carcinogenic, while the nitazoxanide is very efficient in treating adults and children but is approved by FDA for the treatment of diarrhea related to Giardia infection. So, yung paggamot po ng Giardia, nakadepende na rin sa prescription ng ating doktor. So, prevention and control, proper water treatment. So, dahil ang ating cyst ay kaya mag-survive sa chlorine, so kailangan po magkaroon ng filtration and chemical therapy. Then, guarding water supplies against contamination. Siyempre, dapat merong good personal hygiene, proper cleaning and cooking of food, avoidance of unprotected sex. Saturated iodine solution is recommended especially for campers or hikers before drinking potentially contaminated water. So usually yung mga nag-hiking o nagka-camping sa mga gubat, then naubusan sila ng tubig. So kukuha sila sa running water, sa mga river or stream. Yan. So, nire-recommend daw po na maglagay ng saturated iodine solution. Then, portable water purification appears to be effective din. Siyempre, dapat, para maiwasan na lang din na hindi kumuha sa mga stream, sa mga lake. Yan. So, mag-provide na lang ng portable water. So, next natin is Chylomastix mesnili or mesnili. So, size range ng ating thrombocyte is 5 to 25 micrometer long to 5 to 10 micrometer wide. So, same din siya with Giardia, pear-shaped din. Pero, ang pinagkaiba niya is yung kanyang motility. Kung ating Giardia ay falling leaf, ang ating Chylomastix naman is stiff, rotary, and directional. So, it has one nuclei with small central or eccentric karyosomes. It has no peripheral chromatin. So, meron din siyang 4 na flagella. Yung tatlo is extending from the anterior, then it has one extending posteriorly from cytostome region or rudimentary mouth. So, other structures niya, the prominent cytostome extending 1/3 to 1/2 body length, and it has spiral groove or curved posture at the posterior end. Yan. May spiral groove daw. So, parang sexy yung ating Chylomastix mesnili. Cyst morphology, so it is size range is 5 to 10 micrometer long. Shape niya is lemon shape with a clear hyaline numb extending from the anterior end. Nuclei 1 with large central caryosome. It has no peripheral chromatin. So other features niya, well-defined cytostome located on one side of the nucleus. Yan. So ating laboratory diagnosis is freshly passed liquid stool. So para makita natin ang kanyang trophocyte. Sa form stool naman daw, usually ang nakikita ay cyst. Then for semi-formed consistency na stool, possible na both ang makita mo na morphologic forms, which is the trophozoite and the cyst. So the iodine wet preparation often demonstrate the organism's features most clearly. So note lang natin, the incestation occurs in unformed samples, particularly during the process of centrifugation. Ayan, so epidemiology, cosmopolitan in its distribution, prefers warm climates. Usually makikita siya in places na with poor personal and sanitary practices. Transmission is ingestion of infected cysts and possible po na transmission ng hand to mouth, contamination or via contaminated food or drink. So treatment not indicated because it is considered as non-pathogenic. So prevention and control, proper personal hygiene and public sanitation practices. Yan. So next natin is Dianthamiba fragilis. So it initially described as an amoeba because this organism moves by means of pseudopodia and does not have external flagella. So yun. Dati hindi siya maklasify as flagella kasi nga meron siyang pseudopod. So it has been reclassified as flagellate on the basis of number of electron microscopic and immunological findings. So ang difference niya din, si ating Dianthamiba fragilis wala siyang cyst stage. So trophozoite niya is 5 to 18 micrometer. Shape is irregularly round. Motility is progressive with broad hyaline pseudopodia or meron siyang natawag nating false foot. So it has 2 nuclei, each consisting of mass clumps of 4 to 8 chromatin granules. So makikita lang usually yung chromatin granules kapag in-stain mo siya using iron hematoxylin. And it has no peripheral chromatin. So the cytoplasm usually bacteria-filled vacuoles. Yan. So, laboratory diagnosis is specimen of choice natin ay stool. So, multiple samples may be necessary to rule out the presence of Dianthamiba fragilis because the amount of parasite shedding may vary from day to day. So, pwede ngayon, meron siya, bukas wala. Tapos, meron ulit kinabukasan, then susunod na araw, wala ulit. So, the organism can blend in well with the background material in the sample. So, usually, hindi agad siya napapansin. So, akala ano lang siya, contaminant or food particle. Yan. So, the Hackinson phenomenon. So, numerous granules and exhibits Brownian motion. So, the RT-PCR, yung nasa picture po natin sa slide, is the most sensitive and have been used to diagnose D. fragilis in patients. So, ang tatak ata nitong machine is Biorad. Yan. So, it is an RT-PCR or real-time PCR. Yan. So, life cycle. So, the life cycle of Dianthamiba fragilis is not well understood. So, the trophocytes are found in the mucosal crypts of the large intestine where they multiply via binary fission and are shed in the stool. So, transmission via helminth eggs like Enterobis vermicularis has been postulated. So, yun na, ulitin ko, hypothetically daw, na natatransmit siya via Enterobis eggs. So, epidemiology, the exact mode of transmission remains unknown, tulad ng nabanggit ko kanina. So, Unproven theory suggests that the Flagellates is transmitted by the eggs of helminth parasites such as Enterobius and Ascaris. So, ang at risk is children, homosexual men, those living in semi-communal groups, and persons who are institutionalized. So, feeding routes natin ay fecal oral and oral anal routes. Wait lang, excuse me. Yan, sorry. Sinisipon talaga kasi ko. Okay, so clinical symptoms, asymptomatic carrier status. Then next natin is symptomatic. So usually yung patient na may infected with Diatomeba fragilis, they have diarrhea and abdominal pain, bloody or mucoid stool, flatulence, nausea or vomiting, then possible din magkaroon ng weight loss and fatigue or weakness. So some patients experience diarrhea alternating with constipation, low-grade eosinophilia, and pruritus. So treatment of choice is iodoquinol. Alternative are the tetracycline and paromomycin. So prevention and control natin, maintaining personal and public sanitary conditions and avoidance of unprotected homosexual practices. The next natin is the Trichomonas hominis. So size range 7 to 20 micrometer long to 5 to 18 micrometer wide. So same din siya ng Georgia, which is spear shape. Pero ang motility naman ito is nervous or jerky. So it has one nuclei with a small central caryosome, and does it have peripheral chromatin? So meron siyang flagella, 3 to 5 na anterior and 1 posterior extending from the posterior end of the undulating membrane. So other features niya, the axostyle that extend beyond the posterior end of the body, full body length undulating membrane, and undulating membrane, conical cytostome, cleft in anterior region ventrally located opposite the undulating membrane. Yan. So, ang ating Trichomonas hominis, wala po siyang stage. Meron lang siya ay trophozoite. So, clinical symptoms, asymptomatic, Yan. So, laboratory diagnosis, stool examination is the method of choice for the recovery of trophozoite. It has no stage. So, clinical symptoms generally asymptomatic. Prevention and control, improve personal and public sanitary practices. So, epidemiology natin, usually ang ating Trichomonas hominis found worldwide, cosmopolitan areas of warm and temperate climates. So, the children are more risk than adults. Transmission niya is ingestion of trophozoite. So, contaminated milk daw is suspected of being one of the sources of infection. Then, patients suffering from achlorhydria, the milk acts as a shield for the Trichomonas hominis trophozoites upon entry in the stomach. So, fecal-oral transmission may also occur. Yan. So, next naman natin is Enteromonas hominis. Yan. So, Enteromonas hominis natin, trophozoite din, 3 to 10 micrometer long to 3 to 7 micrometer wide. So, medyo maliit. So, shape is oval, sometimes half circle. Motility niya is same. Dun sa last natin, which is jerky. So, nuclei is one with central caryosomes. It has no peripheral chromatin. Pero meron siyang 4 na flagella, 3 anterior and 1 posterior. Yan. So, cyst morphology. Yan. Unlike sa ating Trichomonas, na ating Enteromonas, meron siyang cystic stage. So, size range niya is 3 to 10 micrometer long to 47 micrometer wide. Oval, elongated. Nucleus 1 to 4. binucleated and quadrinucleated nuclei located at the opposite ends, central karyosomes, and has no peripheral chromatin. So, laboratory diagnosis tool for identifying cyst and trophozoite. It is very difficult to identify accurately because of its small size. So, careful screening is recommended to prevent missing the organism. So, no treatment is indicated since it's non-pathogenic. So, epidemiology worldwide, it prefers warm and temperate climates, and ang kanyang transmission is ingestion of infected cysts. So, prevention and control, proper personal and public sanitation practices. Okay, next natin is Retortamonas intestinalis. This stage is 3 to 9 micrometer long up to 5 micrometer wide. Shape is lemon shape, pear shape. It has one nuclei located in the anterior central region with central caryosome. It may be surrounded by a delicate ring of chromatin granules. Kung napapansin nyo, si Retortamonas intestinalis, meron siyang peripheral chromatin din. Yung mga nauna nating na-discuss, wala silang peripheral chromatin. So other structures niya is two fused fibrils resembling a bird's beak in the anterior region, only visible in stained preparation. Then trophozoite, size range is 3 to 7 micrometer long to 5 to 6 micrometer wide. So, shape niya is ovoid and motility is jerky. So it has one nuclei with small central karyosomes. It has ring of chromatin granules maybe on the nuclear membrane and has two flagella, while the cytostome extending halfway down the body length with well-defined fibril border opposite the nucleus in the anterior end. Yan. So laboratory diagnosis, stained stool preparation is the best sample to examine for the presence of Retortamonas intestinalis, trophozoite, and cyst. So accurate identification is difficult. So epidemiology natin rarely reported in clinical stool sample. It prefers warm and temperate climates throughout the world. Kanyang transmission is by ingestion of infected cysts. Then found in poor sanitation and personal hygiene areas, and also can be found in psychiatric hospitals and those living in crowded areas. So treatment, non-pathogenic siya, so the treatment is not indicated. So prevention and control is just to improve the personal and public hygiene. Next natin, Trichomonas tenax. Nakukuha sa pakikipaglaplapan. So, size range na ating trophozoite is 5 to 14 micrometer long. It is oval or pear shape. It has one ovoid nucleus consisting of vesicular region filled with chromatin granules. Flagella, meron siyang 5, 4 extending anteriorly and 1 extending posteriorly. So other structures, undulating membrane extending 2/3 of body length with accompanying costa, thick axostyle curves around the nucleus, extends beyond body length, and has small anterior cytostome opposite the undulating membrane. Yan. So, si Trichomonas tenax, dahil nga nakuha siya sa pakikipaglaplapan, ang specimen of choice is mouth scraping. So, pwede rin po gumamit ng tonsillar crypts and phareal pockets. So, the tartar between the teeth and gingival margin of the gums are the primary areas of the mouth wherein the Trichomonas tenax lives. So, clinical symptoms, typically it doesn't produce any notable symptoms. In rare occasion, has been known to invade the respiratory tract, but this appears to have mainly occurred in patients with underlying thoracic or lung abscess of pleural exudate. So, pathogenic role in existing periodontal disease is necrotizing ulcerative gingivitis and necrotizing ulcerative periodontitis. So, itong nasa picture natin, yan, itong nasa picture natin. Yan, yung, sorry, medyo malabo. Pero ito, may white part dito. So, pumasok po dyan yung Trichomonas tenax. kasi meron na talaga siyang sugat kasi nga yung patient ay merong gingivitis. So, parang nakadagdag pa sa infection yung pagkakaroon niya ng Trichomonas tenax. Okay, those life cycle, trypocytes survive in the body as mouth scavengers that feed primarily on local microorganisms. They multiply by longitudinal binary fission, and the trypocytes are unable to survive digestive process. So treatment, non-pathogenic, so no chemical treatment is normally indicated. So usually, pa nag-toothbrush ka, mawawash out din naman agad yung Trichomonas tenax. So, Trichomonas tenax is commensal of the human oral cavity, found particularly in patients with poor oral hygiene and advanced periodontal disease. So, transmission is through saliva, droplet spray, and kissing or use of contaminated dishes or drinking water. So, nakukuha din siya kapag ang couple ay nagsusubuan ng kutsara. So, prevention and control, practicing good oral hygiene. So, toothbrush and mouthwash. Okay, next natin is the Trichomonas vaginalis. So, common-associated disease is the persistent urethritis, persistent vaginitis, infant Trichomonas vaginalis infection. So, persistent urethritis sa lalaki, vaginitis sa babae, then infant Trichomonas vaginalis infection para sa mga baby or newborns. Okay, so trypocyte morphology, up to 30 micrometer long. So it is ovoid, round, or pear-shaped. And the motility is rapid, jerky. So one ovoid, nondescript, non-nuclei, and lahat ng flagella niya is originating anteriorly. So 3 to 5 anteriorly and 1 extending posteriorly. So other features, the undulating membrane, extending half of the body length, prominent axostyle that opens curves around the nucleus, and granules may be seen along axostyle. Yan. So, ang ating Trichomonas vaginalis may be recovered using standard processing methods in span urine, vaginal discharges, and urethral discharge, and possible then using prostatic secretion. So, saline well preparation is preferred to observe the organism's active motility and other typical characteristics. So, pwede rin gumamit po ng phase contrast microscopy. Pwede rin siya makita gamit ang pap smear or Papa-Nicolau smear. Fluorescent stains, monoclonal antibody assays, enzyme immunoassays. Pwede mo rin siyang patubuin gamit ang culture media. So, meron ding meron dalawang process using the DNA-based assay or the affirm BP3 by BD diagnostic. So it is more sensitive and specific than standard processing methods, and yung in-pouch TV culture system created by Biomed Diagnostic. So pwedeng gumamit ng vaginal swabs, urethral swabs for men, and urine sediment and semen. It requires incubation and takes up to 3 days, before a result is determined. So itong unang picture is the example of Affirm BP3. Yan. Then ito naman ay yung in-pouch TV or in-pouch Trichomonas vaginalis culture system. Yan. So life cycle. Trichomonas vaginalis resides in the female lower genital tract, and sa male naman is in the urethra and prostate. So it replicates by longitudinal binary fission and feed on local bacteria and leukocytes. So the trypozoites thrive in a slightly alkaline or slightly acidic pH environment. So the parasite does not appear to have a cyst form and does not survive well in the external environment. So, Trichomonas vaginalis is usually transmitted among humans primarily by sexual intercourse. Yan. So, hindi lang po babae ang pwede magkaroon ng Trichomonas vaginalis. Hindi naman po Trichomonas vaginalis, babae lang. So, kapag ang babae po na may trichomonas vaginalis sa kapag-sex, possible yung partner niya ay magkaroon din. And so, epidemiology occurs worldwide. Mode of transmission is sexual intercourse. So, it may also migrate through a mother's birth canal and infect the unborn child. So, under optimal condition, it can be transferred via contaminated toilet articles and underclothing, sharing of douche supplies, and communal bathing. They can survive on wet sponges and on damp towels for several hours, as well in water for up to 40 minutes. So, yung douche supplies, sa babae ito yung kapag fina-flood mo ng water or betadine or something na wash, feminine wash yung vagina mo. So, kapag ganun kasi na-alter yung pH environment ng vagina, so usually sila yung tapos share mo sa ibang tao, ikaw infected ka with Trichomonas vaginalis. So, yung next na gagamit ng kit mo, magkakaroon din. Communal bathing, yung bathtub or jacuzzi. Yan. Then, yun nga, tulad ng nabanggit kanina, it can migrate through a mother's birth canal and infect the unborn child. Yan. So, meron tayong apat na clinical symptoms. Yung first natin is the asymptomatic Kere state. So, usually occurs frequently in men. Pero kapag hindi na siya symptomatic, so magkakaroon naman ng persistent urethritis ang lalaki. So, condition on symptomatic men. Involvement of seminal vesicles, higher parts of the urogenital tract and prostate may occur in severe cases of infection. So, ano bang nararamdaman ng lalaki na merong Trichomonas vaginalis? Symptoms includes enlarged tender prostate, dysuria, nocturia, and epididymitis. So, patients often release thin white urethral discharge that consists of Trichomonas vaginalis. Then next natin is persistent vaginitis found in infected women. So it is characterized by foul, smelling, greenish-yellow liquid vaginal discharge after an incubation of 4 to 28 days, so usually 1 month. So meron siyang burning, itching, and chafing may also be present. Red punctate lesions may be present upon examining vaginal mucosa. So urethral involvement, dysuria, and increased frequency of urination are common, while cystitis is less common to occur. So usually, yung mga may Trichomonas vaginalis na babae, akala nila UTI lang. So yung pala, kaya pala may burning sensation, may itching is because marami ng Trichomonas vaginalis. So, next natin is the infant infection. So, infants suffering from both respiratory infection and conjunctivitis. So, yung Trichomonas vaginalis, nagmamigrate sila from the birth canal and or during vaginal delivery. So, paglabas ng bata, infected na rin siya. Yan. Ito yung douching supply yan. Tulad nito, betadine and tatak. Ito po yung douching na material. So, para siyang spray bottle. Yan. Sabi kasi, ayan, for personal hygiene as a treatment of vaginitis. So, nagtitreat ka nga, pinayagan mo naman yung ibang tao na gumamit ng douching supply mo. So, ganun din. So, treatment is metronidazole. Then, dapat lahat ng sexual partner ay ititreat din. Then, prevention and control, avoidance of unprotected sex. Prompt diagnosis and treatment of asymptomatic men, avoidance of sharing douche or douche equipment, communal bathing, and close contact with potentially infective underclothing, toilet articles, damp towels, and wet sponges. Meron din naman, meron kaming isang naging case dati sa clinic, virgin daw siya. Then, nagtataka siya. So, yun nga, nireport niya, binalik niya sa amin yung resulta niya, then, question niya, paano daw siya nagkaroon ng Trichomonas vaginalis since sa sexual intercourse nga. Then, tinanong namin siya kung naupo ba siya sa toilet bowl in public places. Then, sabi niya, oo. So, yun. Sabi namin, possible na doon niya nakuha. Unless, nagsisinungaling siya na virgin pa talaga siya. And yun lang. So, ito yung natin na chapter 4, which is the flagellates. So, start na rin kayo magbasa-basa on your own. So, sana may natutunan kayo ngayon. Thank you!